Hello, and welcome to day 2 of the NNLM Showcase Symposium, a couple of housekeeping rules. By attending any and all sessions of this symposium, you agree to abide by the NNLM Code of Conduct. Failure to do so may result in removal from the symposium. There will be an evaluation at the end of the symposium on day 3 that will be made available on the VFairs lobby during the last session. We will also send an email to all registered attendees with the link to the evaluation. A MLA code will be provided for you to claim continuing education credits for each of the sessions you attend. For today's session, please feel free to utilize the chat feature to ask questions of our presenter during the session. Alta Porterfield is the Delaware Library's statewide social innovator and takes to heart the social innovation mission to help you find and take your next step. The social innovation programming started with job seeker and small business programming, but quickly added various AmeriCorps Vista programs, including social sustainability, healthy futures, literacy, and telehealth. Collaboration with nonprofits and government agencies are key to social innovation sustainability. This is a large part of Alta's day-to-day work, networking and putting all the pieces together. Her early career started with running a placement agency after being awarded the top Texas placement counselor at age 25. She learned early on that a successful project requires empowering the team with resources, support, and trust. Her team has won countless national and regional awards during her 10 plus years with Delaware Libraries. Everyone, please welcome Alta.
Thank you, Tony. Go ahead and do the next slide, please. So Tony is running the show here. Actually, after that wonderful introduction that you said, it's almost like some of my slides I could just like X. You covered quite a bit there. So I want to start off with saying this. The Social Innovation Team is part of the Delaware Division of Libraries team, and we work with social determinants of health. So I'm going to start talking about the teleservice program that was launched by Nick Martin. And so so I've got his picture rather than mine up for a lot of reasons. My picture is getting older and not great to see. But Nick started with us as an AmeriCorps Vista, which is a service-oriented position, just like the Peace Corps, but in America. Started with us in 2018 as emerging tech. And in 2019, he needed to pick a focus project and went to all the libraries in our state, which a key with Delaware is you can actually physically go to every library in the state and do it within a quasi-short period of time. He spoke with the directors and staff and gave them a menu of thoughts that he was thinking of as possibilities for his year project. At the end of that roadshow, by far the most popular one was teleservices, telehealth, and working on that focus, which went really well with our social innovation team at that time. And I'll go into more details later in the talk on why. So the next year, he went ahead and took the 15-week program to become a certified advanced telehealth coordinator, and also started writing grants, because part of with our AmeriCorps Vista program is that they need to start self-funding and finding volunteers and capacity building in order to make it work. So it was incredible, the amount of things that Nick came up with and the funding and all. In fact, I needed to thank NLM for part of that, because they did fund some of our kiosks later on down the road. So in 2021, we did our first launch, and it was with 3 libraries in a rural part of our state. I'll show you the kiosk and show you the where and all that in a little bit. So I'm basically taking you a timeline through to begin with. I'll get to more exciting stuff in a second. But 22, 23, of course, we all know that COVID's happening during all this time. We kept working on more grants. A specialist were hired to be working with the kiosk itself, as well as an administrator to run the teleservice system. Nick was at this time starting to slowly get out of his position as a consultant, because after his first 2 years, we hired him as a consultant. While doing all this incredible work, he's also starting his own company. He co-founded a company and is one of the Forbes 30 under 30, believe it or not. So he's just like incredible. His background is a chemical engineer. So enough of nodding to Nick. We thank him very much, and we wish him well on his journey with other things. So next slide, please. think I slurred that slide word. Okay, why did you choose Delaware libraries? I think honestly, this slide on the left would fit most states and most systems during the COVID period, right? This is actually our statistics when we were writing this for our grants was really more of 2017, 2009 statistics, because during COVID, the depression and anxiety and all actually was increasing higher and higher as time went on. Lack of mental health specialists. This was especially true for all medical providers in our southern part of our state, so which is our rural part of our state. So when we started the kiosk and all, that's the emphasis we put on our starting of our kiosk and all of our focus for our grant writing for the first year and a half was the southern part of the state. So what we have here is the little T's are for teleservice spaces or teleservice kiosks with specialists. And the other ones are our public libraries. So there's 33 public libraries in our state. So next slide. Thanks, Tony. So we have a wonderful team. We have a social innovation team, which is the working with social determinants of health. But in the division of libraries, we have a design team who are incredibly creative and have and coordinate with the libraries throughout the state. And they came up with this sandwich boards and runners for the tables and lanyards. And it'll say on the lanyards, how may I help? So part of our thing is we're calling everyone in our team a specialist. We feel that anyone who comes up to a person in the library is asking help. They don't know if you're a librarian or what your title is or what your job is. They just need help. So we are not worried about titles. Social media, we did quite a bit of social media. In the beginning, we had money for car wrap. I don't, those where you wrap a card, it says what it's all about. We had them running around. We had some billboards. We had radio ads. We also had Nick was on radio talk shows quite a bit in the early beginning. And later on, just in the last year, we've had our Delaware Substance Abuse and Mental Health, DSAM, has actually gone ahead and worked on a campaign with radio advertising as well as billboards, as well as going to doctors and clinics offices, talking about our kiosk and telling people about it, especially for medical assisted therapy, MAT, and especially in our southern part of the state where unfortunately, some of the problems I was discussing, including the opioid, has really been flaring up. So that is this is a view of that picture. And if you would please, next slide. And please, everyone, write comments and questions you have. I think what I'll do is I'll rush through all this and I'll spend as much time as possible to answer questions on that. And though I know I said in that little bio that I worked in Texas, I'm originally from New York. So that New York style of talking is, still stays with you for the rest of your life. On here, we have the teleservices. And so with teleservices, we're talking about people that are looking for telehealth, telebehavioral, which a lot of our grants in the beginning were more behavioral and therapy as opposed to the regular health visits, as well as job interviews or working with a lawyer pro bono or working with immigration. We had, and so it was anything that needed a virtual appointment with a professional is what we looked at. With our teleservice specialists would help with reserving the space. They would also help with all the services on the left-hand side. So basically help with benefits, food benefits, Medicaid, long-term care, you name it. Basically, they listen to a person and get what they need. So what would happen is a person would come in for an appointment for, say, to speak with a therapist, and they would do a small intake. They would do the appointment, and the specialist would say that we're here for other reasons, if you need any other help in any other areas, and then they would just help them with those things. So it's kind of a soft touch. The main thing is that they're there to listen, and that really, it's a good word of mouth, and it really helps people with a lot of other things. So good. All right, great, Jason. So So that I do want to say that we also, like a lot of libraries, we early on we got a grant for which Nick got. So it's Nick, to borrow Chromebooks or in hotspots in the circulation. We also got from American Health, we got blood pressure cuffs. So we were thinking about putting the blood pressure cuffs in the kiosks themselves in spaces, but we decided not to, because really in order for it to be correctly used, you should bring the blood pressure cuff to your doctor to get it calibrated for you. And we decided that we don't want to take the risk of people running it and not getting it right and all. So people can take home a blood pressure cuff for up to 12 weeks and bring it back. And we also work with another program. We can actually keep one for free. Keep everything's free, but keep it permanently on that. On the right-hand side is an example of our kiosk. We have 3 different sizes. This is our medium size. It holds 2 people. And in there, we have UV sterilization, HEPA filtration. I'm reading the words, right? Hand sanitizer, all that good stuff. So you can lock the door and poof, on comes all these lights and all in it, and it cleans it up. And again, remember, a lot of this we were buying was during COVID. So that was really super important that all this was cleaned on that. That little insert of 2 people is important to us because the woman on the left is our Congresswoman Lisa Blunt Rochester, U.S. Congresswoman, and on the right is U.S. Senator Tom Copper. So she was demonstrating on an iPad in the kiosk. We also have a we also have a computer, and we also have a board that you can wipe clean with your notes that you want to write, and then we ask that it's wiped clean. We don't want paper in there because of PHI. I actually have a live guide that I'm going to share with you that's a private link that will have tremendous amount of forms and videos, a video on our of this, as well as a lot of different things that I think will help everyone to look at if they're thinking of doing this and share, ask questions, get in touch with me on different things. So you're going to be really impressed, I hope, with that live guide itself. It's a lot of the things are what we did and ended up not working, or working really well. So I'm going to ask to go on to the next slide. You can't read this. I can't read this. So why have I got this up there? When and if you look at our live guide, you can blow up each one bigger so you can read it. And what this is a decision tree. So every one of our 13 teleservice libraries has a decision tree specifically for their library. So if a person comes into the library and has all these needs, but a specialist is not there or a social worker is not there, the person they're coming to can look at this and see different places for the person to go to. So it's like, if the person's there, this is what you do. If they're not there, it goes down through the list. So it's legal, job related, housing, food, all of it. And the thing in green, which I really am very proud of, is we had someone go ahead and go to the places which they say that would be the best to call for certain things. So it's only a few places, not all the places, but it also puts down the miles from the library. Unfortunately, a lot of people walk, because not only do they may not have bus transportation, especially down south, but also people can't necessarily afford the bus. We do have some bus vouchers, but not enough to give everyone buses all the time. So please, the next slide. And I'm sorry that you had to look at that mess. I'm carrying on that trend because I'm not really going to go through this slide a lot. This was actually a poster contest, and we won. And what it is the telehealth in our public libraries. We wrote telehealth rather than teleservices. It was for a hospital that we presented to a program, and it just talks about a lot of things I'm going to go over. So I just wanted to show you, if you wanted to look at something like this, is a nice little one to look at later. No one really goes back to PowerPoint, so I'm not expecting you to. But the other thing is I'm showing off how we can write all this information, get the data and information, give it to our design team, and they make the magic happen. So a lot of these things that we have on here are things that we have done with other programs, and they put it all together. So that's like it's very special, at least to us. So next slide, please, Tony. We were asked by Public Health, our state librarian and division director for the libraries, Annie Norman, was asked to be the editor for the Delaware Journal of Public Health. Comes out 4 times a year, and it was done in September of 2020. There's a link on here that you can actually go to the virtual journal itself. And we were very proud that we were asked to do this. And it's not just for teleservices, but we are doing a lot of things in health. And also we work with a lot of partners. And I'm going to go in more detail with the partner piece in just a little bit. The other thing is that we have been collecting stories for over 10 years and working on frontline with with people that are in need, so with basic needs, essential needs. And so that we started looking at the stories. There's success stories, there's stories of woe, there's also stories of how we can't even help them. There isn't the resources that we can help them with. So we went ahead and did a basic needs chart, kind of looking at the Maslow, as well as dividing it up. And a lot of people are very interested in how we came up with this chart. It's not perfect. It's always being tweaked, but it helps us think about what partners we can work with to get things done. And also what happens is on our intake form, people will go ahead, especially with our social workers and our master's levels social workers, will go ahead and have people do an intake and go over all these things with them as time goes along in their case management piece. So we had UD-IPA, which is Biden School of Public Administration, help with this mapping along with the lean manufacturing. So we're very proud of this project too. So next slide, please. Okay, this is me. I'm sorry that I'm showing off so much, but that's kind of when you do a presentation, you kind of say, "Ooh." So there's a lot. So this was another poster contest with Department of Health and Social Services, and the division director for social services said, "Don't even bother. This is so competitive to get. There's just no way you're going to get it." But I said to him that, hey, you don't know our design team, so we can put all these discriminate things together and they can make a beauty. So this is about social workers in the libraries. So this, back in 2017, we were very fortunate to start a program where social services started giving us libraries and social workers in the libraries. How did it happen? And I think this is kind of a key. I'm kind of walking from the teleservice to the social workers and all the other things we do kind of backwards, but it lets you know how all of this has been a single thread of we're listening to people, helping people. Back with Avista, back in 2015, Healthy Futures started with meetup groups in each county of nonprofits and government agencies meeting once a month for a get-together for lunch. Bring your lunch, eat and talk to each other. And a lot of leaders, division directors, leaders within the different government agencies and nonprofits were starting to come to this, especially Kent County, they're Middle County. And they were seeing all the people that their organization was, the people that were in our libraries were the people that they were trying to help. And they saw and hearing what we were doing, and we got more and more help with all the different things that we needed help with, and much more support. Our Annie, our division director, spoke to our Secretary of State, who's our lead organization agency, and our deputy went ahead and talked to social services and said, hey, we need social workers. And pop, poof, we got them. I'm very proud of our state social services because one of the first libraries, they started off with 7 libraries. One of the first libraries that they said we were going to go to was a small little library in a small little rural town that really has very low attendance. Like, why there? Because really it's very isolated and it's hard to get to the state service center. There's 15 state service centers and 33 libraries. So they said, this is an area we need to go to. And they did. So even though the numbers were low, the people they were helping, they really made tremendous strides for. And those people would not have gotten the help on that professional level without them. So that's a little bit of that. And we had the social workers also tell us and send us stories. So we captured the stories and part of the data on that. And you can see some of the same little, you know, pictures and all that kind of go from one thing to the next. So next slide, please. I better check my time because I know I'm talking and a half here. Okay, social innovation team. So we've gone through a lot of name changes. Started off as Job Center, right? Then we were the inspiration space, and now we're the social innovation team. So it's always been the same thing, though, working with people frontline to help them with the next step. I'm the lead. I have another person who works with micro business, maker spaces a little bit, but also working with the nonprofit sector on all that. So we have a teleservice administrator and a specialist I've talked about. We also have the AmeriCorps, which we've mentioned throughout. In there, I just want to say something. I have one lead and 8 full-time vistas. I have on the teleservice team, I have 2 vistas. One has their master's in health care compliance through George Washington University. The other one is a psychiatric nurse finishing up his a PhD in applied psychology. So wow. We have a healthy vista. Social sustainability is working with disaster planning, which goes very nicely with the teleservices piece, disaster planning, toolkits for the libraries, working a little bit more with climate than we were prior in all. 2 literacy vistas, one with 2 master's degrees. Also, it has been a teacher in high school and as well as a librarian and grade school. And digital literacy, who was full-time, was a Peace Corps teacher, is now in the summer supervised our digital literacy associates who did the Affordable Connectivity Program, which all of our people are certified in, and North Star in 18 libraries. So that was very noticeable throughout the state on that piece of it. And obviously emerging tech, because that's where we started with Nick. I have a licensed social service coordinator who supervises our basics needs interns, master's degree, and undergraduate level from various regional colleges. And I honestly am saying from, we get college students from, our state's small, so we get them from, Pennsylvania, New Jersey, and we actually even from Virginia as well as Maryland on that. And that person actually started off as a behavioral mental health vista a few years back on that. Grants project manager. I have one person working with our grants. We now have a grant with Talkspace, which is 24/7 texting and once a month virtual appointment with a therapist. And that program is a 3-year program. We're not advertising it. We're working with certain organizations to refer people to us that they feel would benefit. And those people are, we're looking at people that don't have insurance, and we're going to try and help them get insurance as they're going through the program itself and not in crisis level. Data scientists looking at all our data. We've got lots of stories and lots of data, but now we want to pull it together more, and that's not happening. We also have a program now that's also not being advertised, very similar to the Talkspace, where we're giving out Fitbits and working with people in the foods, nutrition and health and the Zumba classes and all those walking classes, all those wonderful things that happen in libraries and all like that. So that's another program we're working with. Our social workers, pre-COVID, we had them in 22. We now have them only in 11 libraries because of all the reasons why with COVID, and they're still not caught up on things, but we're working towards adding more. Actually, it just happened this week. We're talking with the cabinet secretary. Department of Labor used to be in our libraries. We had in them 6 libraries. Right now, they are also short-staffed. So we're doing it ourselves through these social service coordinator, who has a staff of other people beyond the interns itself. So I'm sorry I keep blabbing away here, but next slide, please, Tony. Ask a Librarian, wonderful program. They do so much. They really help us in so many ways. Sometimes we're really overwhelmed, and they'll help with some of the quick things they know about. Unite Delaware, Unite Us. is in many states. When we joined, there was in 23 states. So I'm sure it's I don't know what it is now, but I'm sure that quite a few have Unite Us. It's a program where you can put in a need and then you'll see in real time when the need has been met. And that's really good for us because we'll help with Unite Us, but so often we don't know if the person's been helped. If we send a referral, warm referral, so we really like to be able to work with Unite Us if we need to make a referral itself. Normally, we try to do a lot of this in-house. The make appointment, we started in the first week after we shut down in March. We already were working with LiveCal, which is a software that you can do a lot with programming. And now we use it for making appointments. So people can make an appointment for jobs or social services, and also for our kiosks. So they can make an appointment. We'll call them with the first two, the jobs and the social services, and we'll work with them on their problems and then refer them if they need to go to an in-person person. But often we'll handle it by mail and by phone. We could have done Zoom, but we felt it was easier for everyone if it was just phone. Just because we only have so much time to do all this. We also have a system that we're not managing, but it's on our portal for businesses. So a person that needs help with a business, setting it up, starting it, questions galore. We have that with the business advisor. There's two with small business. We also have one that works strictly with import and with people that are more comfortable speaking in another language. So I know I'm talking fast here. So next slide, please. North Star, I'm sure a lot of you have worked with North Star, have North Star in your system itself. All of our people know about it. Most of them are be able to be a proctor. We don't usually have them go that far into doing the proctoring, but it's available. And they also work with the connectivity. And we're really focusing on this for the next few years as far as getting more people with those skills, literacy skills, health literacy skills, communication skills, and digital literacy. And that's something I could do a whole talk on and just that piece itself. So next slide, please. Secret sauce, it's system thinking. So Annie, our state librarian, this is her really, she's very motivated in the whole social innovation team's vision, but she's also very good about strategic planning, working with the Baldrige, working with Lean, the balanced scorecard, the idea that you're looking at the whole system rather than just jumping and trying to do a Band-Aid approach to things. It's really made a difference. So in our state, all the libraries are connected, all the public libraries are connected, as well as many of the academics, many of the school libraries, so that if you, so our circulation, it's all connected. So if you want a book and it's only at the bottom of the state, you just go on our website, you get it to your home library. And same thing with a kid at school. They don't have to go to if their school library is connected, we'll actually send it to their school library so that they don't have to worry about getting to a public library. Partner listserv. Back in 2008, we got a big group of people together, nonprofits, government agencies, and they met up and we decided that great thing, just keep this energy going by having them all join a listserv. So if they have an event or something or a need, they could put it into this listserv and people could respond to them and get things happen or know about it. And the nice thing about a listserv is you don't hear all the, oh, that's great. Yes, I'll be there type of thing. It's all, you meet directly with the person that sends it and all on that. The other thing is that a lot of the nonprofits and all, they will have one person get it, then they'll make sure their entire front line and other people within their organization get that email. So it's not like it's going out to many people, but it's not going out to so many that the thing clogs down. I already talked about the innovation team. We happen to, I won't say we're experts because you're hearing me speak, and that's not so fantastic, but we're extroverts. We're not afraid to make mistakes. We're not afraid to ask questions. We're not afraid to go up and talk to people. And that's kind of how we get a lot of things. I'm not afraid to ask for money and help and all. So, and so is the rest of our team. And we're embedded. We're in the libraries. So we kind of get to know the libraries. We get to know the communities. We get to know what some of the needs are. Just in time, what we're talking, I'm checking my time here. Just in time means that we're listening to people. Sometimes people in need, they're in crisis, and they really have a hard time communicating what their needs are. So we have to listen and we have to help them. And sometimes we have to help them figure out what they need to do, right? And so sometimes it's a great time to show them North Star so they can learn online computer classes, but other times they're not going to be able to. I remember one time we had so we often have flu vaccine shot, and we had COVID shots too. We had a Hep A vaccine going through at one time at a couple of the libraries, and a person was in line. Hep A is a whole nother vaccine and requirement. And the person said, I really can't stand in line any longer. I need food. So their priority was that, yes, they wanted that vaccine, but their most important thing was they needed food. So that's what we concentrated on. We got them to a food pantry, which was luckily not just the crackers we have in our storeroom, but a food pantry that was literally across the street. So I think our secret sauce too is that we start small. We're not afraid to try things out. And if it's not going the right way or what we thought we were going to do, then we stop and pivot. So let me give you an example. We got funding and we wrote for nurses. So we got 2 traveling nurses, and this is early COVID, and it was working out quite well. But it started pivoting where we needed them to do more things, and they needed sinks, they needed a private space, they needed bathrooms and all that. And libraries aren't built like that for the most part. And it's going to cost money, infrastructure. At the same time, what was happening is a lot of the hospitals were getting money coming in for the vans, and the vans were finally being built, and with the medical vans. So it was great timing for them to come and be in our parking lots and do those type of services and not have the nurses in our libraries itself. We have had in the past, and some of our librarians through the wonderful classes there and certifications through NMLM have health background, right? And be a reference librarian or consumer librarian too on that. So we don't need to go the extra level on that itself. So that's an example of pivoting and trying things out and all like that. I have many others, but I'll go with the next slide. Well, see, I didn't. So I have on here Annie Norman. She's, as I said, our division director, and wonderful, and I call her our fearless leader here. Myself, I'm the lead for the social innovation team. And I think that really the thing I want to really, if you were going to talk about this to other people in your organization, please just go to that guides.lib. It's a private link. You have to use that link. You won't be able to search it on our live guides in our website. And we've collected a bunch of it's not confidential information, but it's a lot of information, forms, and it's a tremendous amount of stuff, including all those decision trees and PowerPoints and videos and all that. Speaking of videos, NMLM has gone ahead and chosen libraries. Thank you, Heather. Has gone ahead and chosen Delaware libraries and had filmed us for a video, which is really exciting. And they went to several of the libraries and filmed, and we spoke, and we're going to also be on a podcast. And so that's fun. It's very fun and very exciting and all. We were hoping that would be done so I wouldn't have to talk to you so much if you see the pictures, but you'll stay tuned for that to happen on that itself. So I am ready to look at the questions. And if you want to unmute yourself, I'm great with that too. So I'm gonna look at the questions. Oh, I can't. Okay. Okay, so the first one's about health systems. So yeah, we actually early on, we talked to Buffalo, New York, about some of the things that they were doing in the library system. So we worked with we talked to actually, well, before we started the launch, we spoke to every single hospital health organization, we come up with a lot of all our we had three medic, well, at that time we had two medicates, and we had three medicates. We talked to everybody we could think of so that we could get their input and ideas on things. And Christiana Care, which is our largest one, hospital system, they actually provided us with a nurse. So we had two that we paid for and another nurse that they helped us with. And then we ended up getting their van there. So, but when it comes to people coming into our spaces, we don't work with any particular one. We work with everybody. So we have the laptops are filled with different places where they can go on to the websites and to the different locations they need to go in, like My Health and all that type of thing. So I hope I answered that. Tell you what, I'll answer the questions and then you can re-ask questions. Okay, so the libraries don't train, we train. We utilize the Department of Social Service, Delaware Social Services has given us some training classes that we have kept. We're talking about doing more videos with them. We have our master's level, she's a social worker and also counselor that works with us. She does a lot of the trainings for our specialists as well as for the interns and all. We have a lot of different trainings, and we have a wonderful, within the Division of Libraries, has a wonderful professional development team, and they're constantly giving us and suggesting classes for us to take. Our thing is I'm trying to work with now is that to make sure we give enough time. If you're busy working with frontline, you can't get all these classes. So I want to make some time away for that they're not scheduled to work except for training, right? That's one thing that our interns coordinator has done. She always makes Friday mornings. It's completely not for anything but trainings on that with her and with other people itself. So yeah. So the specialists are the stories would make it's unbelievable. It's unbelievable the stories we have. So it's just crazy. All right. So I see other questions people have. Please unmute. Because I jumped through this really quick so I could get questions.
So, Alta, I just wanted to make sure it's okay if people want to contact you in the future following this for ideas and everything. So it's okay for me to just share your email.
Oh, absolutely. Oh, no, absolutely. I literally get at least one email a day. I have someone from California that wants to talk about the kiosk spaces. And I send her a link because NNLM did a video of just the tour of our kiosk. So it's on that live guide, right? I keep on like feel like I'm advertising live guide to death here, but I sent that to them and I gave them the vendor we use, but we're going to set up a meeting for the things we found as problems and good things. So I'll say about kiosks that the best way to go if you have room for it is to go with your own study room. You've got a study room that's decent size, but not too big, and then retrofit it. All right. And if you don't need the space, if you need the space, obviously it's not going to work. But you have to retrofit it. So what we did was when we thought, well, we had 4 libraries, so they have enough space, but we'll retrofit their rooms. Well, they're not soundproof enough. Even one that they thought was soundproof enough, it's not soundproof enough. So we got more soundproofing panels. One of them we actually had to get a technician in to put in some equipment in there. I'm not exactly sure what it was, but it was very costly. So I wouldn't recommend that. I would really start going with the sound panels first. Right. Yeah.
And you see that George is mentioning that NNLM has a Telehealth 101 class, what libraries need to know. What were some of the lessons learned that you think something didn't go the way you thought and you needed to make a pivot? How about that?
So I was reading the Buffalo one, but I will stop reading now. I'll come back to the Buffalo one.
Yes, come back to Buffalo.
Okay, so pivoting. In the beginning, we really tried to focus as much as possible on telebehavioral. And it's a hard lift for people to come in to a library if you're identifying that they're probably telebehavioral. It's much better to say teleservices than say telehealth or telebehavioral and all that. So I think that was we weren't putting the messaging out there as far as words go, but that was the rumor we were saying. It's partly because when we started off, we were telling libraries that this is not going to be a lift for you. We're gonna hire the people. We're gonna train the people. We're going to do the scheduling. It's all going to be online. We'll open it up. We'll shut it down. So that, but then we told them that they were worried about. Again, remember, it's early COVID, that they were worried about coughing and sneezing and COVID. So we said it's going to be telebehavioral. So you're not going to worry about we're definitely going to say you can't come in if you're sick and all that type of thing. So, but that gets out there. So that's one thing. And I also think that another thing that we learned is that the specialists are fantastic, and I love that. I think that's our best thing that we do, but it's not sustainable for a program if you spend a lot of money on this kiosk and it's taking up space in a library if it's only there when you're open with a specialist. A library can be open from 9 o'clock to 9 or 10 to 8 or whatever the hours are, right? 6 days a week, 7 days a week. And then you've got this only, our specialists are 20 hours a week. Then you got them there for 20 hours. That doesn't make sense. And not the hours that people are doing it, right? So what we're doing right now, and it's taking a lot longer than we thought, but we want to make sure that when we do something, we have thought through every possible thing possible, is to make sure they can use our online service like they do for jobs and for the social services and the business and the kiosks, that now people that are going to be able to sign up and it'll say clearly that a specialist will be there or a specialist will not be there, and you realize you will have to do the XXX. So we're doing videos and all in the rooms to make sure that they know how to use it. So now we're asking our library staff to open up the room, unlock the room, and make sure the computer is on for them and all. And so we're making sure as much as possible that they do a survey. So let me see. All right.
So the question from Buffalo is, you
Yes.
mentioned Buffalo, New York. Did you work with the library system in Buffalo to learn how they were doing telehealth, how they were using their telehealth equipment?
So we talked to them. They probably reached out to us rather than us reaching out to them. So they were wondering what we were doing and all. We were asking them. So we didn't get back to them. So this is a bad thing, right? Sometimes you get asked a lot of questions because we're early on. The one thing that surprises us about Buffalo, I'll say this, I'll being very transparent here, is that we were shocked when Western Buffalo, I forgot which one it was, but um, I forgot which county. I'm actually from Rochester, New York originally, so I know Buffalo pretty well, but I can't remember which one. They said they were almost as busy as they were prior to the shutdown, and we weren't. Okay, it was Erie County, but I don't remember which library system of the library. But so the deal is that we were shocked how busy they were because we were very slow to begin with. We were pretty. Now we have a lot of people coming in for. We were the first state to have all the libraries giving out COVID home test kits and the food pantries outside and on and on and on, all that. But the people coming into the libraries was very slow. If a lot, curbside was very active, but people actually physically wanting to come into the library, staying a bit of time, wasn't happening that much. So that was something. So you know what, Jason, I'm definitely interested in getting back to you with you on the Buffalo piece and all. I saw that there was another question too.
So there's a clarifying question.
Okay,
All
good.
of the teleservices were fully staffed by staff members supplied by the state library who were trained by the state, not provided by the library. Is that correct?
Correct, but they weren't full time. So it's part-time staff that were trained. Right, is correct. We're trained by the Division of Libraries people and other training programs like NNLM and all these other things. Right, right. Um,
Okay.
yeah. Now our library staff throughout the state are welcome to take any of the classes that are offered through the professional development. Their trauma informed care and all that information is they're definitely there to do it, but we weren't asking them to do any of the trainings. We're welcoming them to take the trainings. We had at one point, and we still do have some peers in the libraries. They're coming from outside to come in and help with different things. So library staff is very happy to have all these different programs because we're short-staffed. I don't know about in most states, but our library system is, we've been going through a lot of people leaving and transferring, a lot of changes. So we're really again, it's a transition mode in a lot of different ways on that. So yeah, so other questions?
I don't think this is a question. I think someone says they're fortunate that their project is partnering with a large research institution and plan on having open house events with a clinician on site to moderate, and that's in Erie County.
Okay.
That's with Jason. Jason,
Okay.
do you want to add anything since you came on camera?
Yeah, absolutely. I found today to be really enlightening. We're in the midst of a pilot here in Western New York, in actually the greater Rochester area, working with a group of libraries who have telehealth resources on site, but they're not being used. They're just literally, our baseline is zero. So we've been fortunate that we're working with the University of Rochester Medical Center to assist us in this outreach effort to try to connect mostly our rural populations with telehealth and specialty care, primarily with specialists that are up in the city that are actually a long way for them to drive. So the idea of telehealth using the public libraries in our rural communities is absolutely the direction that we want to go, but we're really struggling with how to gain traction. We've been at this for almost a year, and we're still kind of trying to find our way. I did type in the chat that we plan on doing open house events in the first quarter this year, using some of the clinicians that have volunteered to help our project to speak directly with the patrons at the library.
Nice,
and hopefully we can gather an audience. But I absolutely am going to go to your website, and we're going to try to maybe replicate some of the resources that you've used. We've talked about bookmarks with possibly a QR code that they can watch a mock telehealth video,
yeah, nice.
and things of that nature. So, thank you so much for today's presentation.
So it's I'm not saying we're like unbelievably busy and we need more staff, the hours that are staffed, right? I think the fact is that if rather than just telehealth, if it's teleservices, you're going to get, sometimes it's that easy. Well, I need to help with this. Oh, you have that. And it just kind of like slowly rolls into things. And some of our staff are coming to see our specialists, and that's what I think is really good. So, and they refer their family members and all. So that's something I've always talked about when we started with the social worker program, is letting them know that that's there too. So this is not perfect, right? There's so much more that we could do than we're doing, but we're making such a difference as far as the people that are coming to see us. Like, wow, the stories are unbelievable itself. So don't beat yourself up. I mean, it's just, you got to keep at it, but keep tweaking it, type of thing on that. So yeah, so that's good. Now we're pretty well known. It's a small state, so we're pretty well known because we reached out to everybody to begin with. So we're asked upon to do things. I've spoken at the hospital conferences. I'm not a great speaker, as you well know, but I'm not shy either. So I'll ask questions and all. And early on, some people were saying, "Well, why are you in the libraries?" And I said, "Well, it makes total sense. People are coming in there. They trust us, right? And they don't have the internet, or they don't have the ability to use the computers and all." I think the one reason why it's not as fast of a growth you would thought is that the amount of people that are using their smartphones for their telehealth is really grown exponentially. And when we were doing this in the beginning, the research was that they were not going to be insured to use their phones. It was going to have to be different system pretty soon, and now they keep on saying that they're going to extend it. They're going to extend it. Same thing with the mental health therapy. They're starting to say that they're going to continue on with that, where you don't have to do your first visit in the doctor's office. So I think things are going to continue on in this way itself. And I've attended quite a few telehealth programs through the hospitals, and it's interesting all the things they're doing with telehealth in the hospitals itself. So this is going to be where you'll have a person in a room. I don't know if you guys have seen this, but they'll have a person in a room like a traffic control operator, right? And they're watching all the beds. And then if a person needs something, they're actually being able to tell someone. So they're watching, the nurse is watching a whole bunch of people at the same time. But they'll also have the doctors come into the room on these big, beautiful screens to be able to do a health visit to the patient that's in the hospital. So that's another thing that I think people are going to get more. It's like anything else. Once you get more used to it, you're going to be more willing to do certain things. And our whole thing with our grant writing, a lot of it was reducing emergency room visits. So it's like, hey, we can reduce emergency room visits, especially in the rural areas where people are going, not necessarily to hospitals, but like clinics, or, I mean, and the waits, some of the waits, people, this is horrific to tell you this, but some of the hospitals sometimes, the wait is over 12 hours in emergency room. I mean, literally, and sometimes what they do is at a certain time that they're waiting for the next shift to come in before they see the next group of people. So, yeah.
Well, I typed it, but I could have come off mute just as easily. Yeah. Did you see a difference in the older? Because our target audience seems to be a little bit older in our rural communities here in Western New York, and maybe less IT savvy.
See more people that are older. They're coming in. Interestingly, I don't remember the statistics, but we were thinking it was going to be more. We were thinking it was going to be more women than men, but it's actually been more men than women are coming in, which was surprising to us. So I think that's a good thing to say, is that don't go in with preconceived knowledge. We can research and talk to people and get all this information, but don't listen to what I say. You basically got to experience it, try things, because your community is going to be different than my community. Your word of mouth network is going to be different than mine. And that's one of the things that was brought up about Nick, was I love the book Tipping Point by Malcolm Gladwell. You get the right person in the right place. Where you get the right person, like Paul Revere, he told people, and what we know about Paul Revere, there's a second person that was the same thing as Paul Revere that did the south part of Boston, and you don't even know that person's name. So you gotta keep out there all the time and letting people know. And I saw someone else popping on there. So please, anyone else?
Not yet, but there is a question that came in.
Good, okay.
Did you have issues with privacy of medical information?
Yes. So we had a grant for TytoCare, and we actually had early on, we were getting all the libraries that were interested in teleservices to do a once a month meeting, and we had a TytoCare individual come on to talk about TytoCare, and we ended up working to set that up. So it's remote patient monitoring. We would give a person a unit, it was like $400 unit, and then they would be able to, when they had a earache, they could put special size in for their kid's ear, or a bigger one for the adult ear, or their throat, and all that good stuff. And then the doctor could be able, or whoever, the medical provider could go ahead and see what was going on. Our state's very involved in, as every state, with cybersecurity. Our state, Delaware, is pretty well known because of the incorporation, right, of all these corporations. And so they're really, really cyber secure. So they wanted to own all the data, and there was a lot of things they wanted. It's like, we don't want all this data, and we don't want to be considered a place to share data with doctors and everybody else about records. We do not want to be in the medical record sharing business. So we got out of that we stopped that grant. So that was one area. As far as PHI, we go ahead and our Department of Health and Social Services uses egress. and all. We're using a form of encryption through the Microsoft. Microsoft has several corporate levels, and we're using that. For simple emails, we go ahead, and if we use, right now with the data centers, trying to automate more of our stuff. But we have some paper forms we use, and those are being locked up after a person fills them out, which is not a way to go. But they're locked up, and we ask for people they're using the kiosk. There's that whiteboard. They can write down notes from the doctor or whatever, but they can't, and they can take a picture of it, but they cannot leave paper in the room. So we don't have, because people can like crumple up a piece of paper and then somebody else can go in the trash can and get it. And all that stuff. So we're trying to be as good as possible about that. That's why our healthcare compliance person was very helpful. We've had hospitals look at our things, that our surveys and everything else. We hired a company to look at our contracts, to be able to look and see if it all makes sense. We had a lawyer review a lot of our different documents before we went live on different things. So the advantage is that with the state, we have a lawyer that's dedicated to the libraries.
Great. I think we're about time, Alta. So I want to thank you so much for your presentation. And it sounds like there are some folks who are very interested in hearing about telehealth services offered at different libraries. So I definitely appreciate your time and spending with this with everyone here. So we will end today's session, and then at 3:30, we hope that you'll join us for One in a Million Health Outreach and Programming with the All of Us Research Program in Public Libraries. This will be presented by Lori Stearns, Michael Balkenhol, and Michelle Lesniak. So thank you all, and have a wonderful afternoon. Bye.
Bye.